Hi everyone, my name is Dr. Ishita Marwah. I hope you're having a very fun and interesting time with HimSurabhi today. Today, I'm going to be talking to you a little bit about endometriosis. Just some background on me. I am a physician and a scientist by training, but my talk today is not a medical one. I'll provide some medical scientific background, but I'm mainly going to speak not as a doctor, but as a patient, talking about their experience of their own illness. I have endometriosis. That's the reason I'm not talking live to you today, but through this recording. By the time you're listening to this, I will likely be in a lot of pain and on bed rest because of, you guessed right, my endometriosis. I mention this because I want us all to start talking about this illness without shame and with a lot of compassion. Before we proceed, I'm using the word a lot, but I haven't explained it. If it's already been discussed in today's program, please be patient with me. I'll be brief. So, what is endometriosis, or endo for short? It's a condition or illness in which cells similar to the inner lining of the uterus, called the endometrium, grow in different parts of the body where they shouldn't be. This can happen anywhere in the body, from the abdomen to the heart, the lungs, skin, the eyes, even. The issue is that because they're similar to uterine cells, these endomet endometriotic cells, not endometrial cells, because they're not exactly the same thing, they respond to female hormones through the menstrual cycle. Swelling, shedding, bleeding, scarring in different parts of the body, causing all kinds of pain, infertility, and long-term illness during periods, but also outside of them. It is a very painful and disabling condition, one of the most painful diseases in the world. It ranks higher on pain scales than non-terminal cancer and childbirth. The confusing thing about it is that people can present in very different ways. Some may come with heavy bleeding during periods, others with bleeding outside of their periods, unbearable pain in their tummies, their backs, legs. Some might only present with rashes, tiredness, headaches. Also, the extent of symptoms doesn't always correlate to the stage of illness. You can have the lowest grade, stage 1, and be in excruciating pain, have the highest grade of disease and have no symptoms. Endo is thought to affect about 1 in 10 women. It's likely to be higher because it is underdiagnosed, because women often get told periods are painful. Put up with it. What will you do when you have children? This is being said to people who are suffering greater childbirth, greater pain than in childbirth. Every month, some people every day. Thanks to this attitude, there is also a delay in diagnosis. It usually takes 10 years, roughly, from the patient presenting in clinic to receiving an endometriosis diagnosis. But these are numbers from the West. As an Indian girl, I had symptoms from the age of 12. I was finally diagnosed age 35. So you can see what the diagnostic delay was like in my case, and this is not uncommon. Current treatment options are either medical or surgical or a combination. Surgery involves removing the endometriosis growths, and while this can be very helpful in the short term, endometriosis almost always grows back. So multiple surgeries are required through a patient's life, and the disease can grow back even after you remove the uterus. So it's a lifelong illness. Medical options include the contraceptive pill, like in India, you have Choice or Maladi, if I remember correctly, which contains hormones that suppress the menstrual cycle. So essentially, they stop your period. But again, the disease can grow back even while you're on contraceptive pills, and some of these pills can make it worse depending on what's inside them and what kind of disease you have. Why don't they work so well? Because they don't target the cause, and they're based on classifying endometriosis as a problem with periods, heavy periods, painful periods, etc. And therefore, the strategy is let's stop the periods using these pills, and it should go away. It doesn't, and that's because in reality, endo is a full body disease that has a number of causative components that come together to make it happen. These include genetic causes, stress, infections in different parts of the body, like the gut, the urinary tract, toxins in our food, environment, an imbalance of the two major female hormones, estrogen and progesterone. All these things lead to the activation of your immune systems, a system in which, in ways in which help endometriosis growths to start and then progress in different parts of your body. So that's why when I say endo is a full body disease, I don't say it because it can grow anywhere in the body. It's because it's a full body inflammatory disease caused by dysfunction of your immune system, which works across your entire body. There is more and more research on this now, but it takes roughly 17 years for scientific research to be adopted by doctors in clinic. Also, in general, endometriosis research is poorly funded and very new. Up to maybe the 1990s, most scientific research was actually performed only on men or on male lab animals, and this was based on the belief that female hormones interfere with scientific results. So on the whole, now we know all of this. The question arises, how can we take healing into our own hands as endo patients, as people who know who have endo or who have painful periods? How do we take healing into our own hands while we wait for medicine and research to catch up? This is not to say that we don't make use of the surgical and medical options that are available. Rather, we just adopt a more holistic, integrated approach that includes medicine and surgery, but also targets more widely the condition in its entirety from start to finish. And this is where food comes in. The gut is where the immune system meets the outside world in a big way. And for many people with endo, this is one of the primary sites of immune dysfunction. And there is loads of advice out there about a long list of food to avoid, reduce the dysfunction, which can be very confusing. I've learned a lot about food and endo from a book called Healing Endo by Katie Edmonds. It's available on Kindle, and I highly recommend it for anyone interested. The main thing Katie recommends is that endo needs you to have a nutrient-dense diet that gives a lot of energy. You have a lot of inflammation going on, you have infection, endo growing, lots of immune cells working over time. All of this takes much more energy than a person without endo needs to function. So you need to supply it. When we say nutrient dense, this does not mean full of calories. For example, just a very rough, crude example, 500 calories of biscuits are not the same as 500 calories of fish because they have very different nutrient contents. Fish will contain different vitamins, minerals, and fats, nutrients which you could never get from biscuits. Katie describes 9 main nutrients that are necessary for endo patients that we are either lacking in or need more of for our bodies to heal from disease. I'm just going to go through these very quickly. First, magnesium. This is a mineral involved in muscle contractions. In the end, the uterus is one big muscle. And women with painful periods, they have much lower magnesium levels than those without. Some examples of foods rich in magnesium include nuts, seeds, and beans. Next, zinc, a very powerful anti-inflammatory mineral, but women with endo are found to be highly deficient in zinc as compared to those who don't have endo. Food sources include red meat and seafood. Plant-based options include seeds and nuts and dals, but it is not as well absorbed from these as from animal sources. Third, iron. Iron, we all know, is necessary for energy production and that we grow anemic without it. Endo patients who bleed heavily lose even more iron through blood loss and grow more anemic, which in turn impacts the body's ability to control inflammation and therefore worsens endo, and you're in a vicious cycle. As a rule, all girls who've started having periods should get regular iron tests every 6 months or so. Animal sources are richest in iron, though green leafy vegetables also contain it to some extent. You can try cooking in a cast iron pan, which can increase the iron content of food up to 20-fold. Fourth, we have vitamin A, which is a fat-soluble vitamin essential for immune function and its anti-inflammatory effects. Increasing vitamin A levels can even shrink the size of existing endogrowths. Animal sources include liver, egg yolks, and cod liver oil, ghee, also found in orange-colored fruits and vegetables. Next, vitamin D. It's a fat-soluble vitamin hormone, more like one we get from the sun. Actually, the sun converts it into its active form in our skin. Vitamin D has many important anti-inflammatory effects. Women with endo are very deficient in it. One study found that 86% of those with endo were deficient in vitamin D, and those who were most deficient had the biggest growths. Food sources for vitamin D, best source sunlight, like I just said, but it can also be found in fish, mushrooms, and egg yolk. Next, vitamins C and E. These are both anti-inflammatory vitamins. Women with endo need much more of these at much higher doses than those without. They both have important roles in immune function and also help reduce endo pain. Vitamin C is found in fruits like oranges. Vitamin E is in seeds like sunflower seeds, nuts like almonds, fruits and vegetables like mango and broccoli. Number 8, omega-3 fats. These are fats found primarily in seafood. They've been shown to reduce the inflammatory response in endometriosis and also reduce associated pain. Plant sources include flaxseed, walnuts, and algae supplements. Finally, phytonutrients. These are a family of plant compounds numbering in the thousands. One prominent example is curcumin, which is an active compound in turmeric or haldi. It has been shown to reduce the spread of endometriosis. Now we've talked about what we should eat. So what do we not eat in endo? I'm just going to give a list of the most common culprits that women with endo report as making them worse. These include vegetable oils, gluten, which is a protein found mainly in wheat, chocolate, coffee, soya, and eggs, especially egg whites. These are not blanket problem foods. Some of the things I mentioned worsen endo for some women, not for others. The best way to find out is through an elimination diet, where you stop eating the thing you suspect might be causing you trouble, then slowly reintroduce it in your diet and see if you get worse after that. Again, not a blanket rule that will work for everyone. You have to check which things aggravate your system. Eliminate only those things to avoid developing any kind of malnutrition. All of this has to be done carefully, making sure you're still eating a balanced diet by the end of it. Just to wrap up, endo is an inflammatory full body disease, and you can manage symptoms to some extent through food. It sounds really complicated, but if you think of all the things I've outlined, an anti-inflammatory diet for endo just means eating lots and lots of fresh vegetables, some fruits, some animal products if you can take them, good fats like ghee and coconut oil, seeds and nuts. These form the bulk of your diet, and you can make lots of tasty meals from them. It's part of taking ownership of your disease and of your body. I hope this talk was useful in some way, whether you have painful periods, endo, or other similar conditions, or know someone who does. Thanks for listening and enjoy the rest of your day.